Hello everyone for another PLAB2 station with Dr. Al. Today I'm not going to dive into one station. I'm going to give you random examples and random tips about prescribing. I'm not going to go about the prescription station. I'm going to talk to you when you want to give a patient medication. Meaning, so let's say hypothetically we decided to start the patient on, hypothetically, let's say statins. Okay? So how do you explain to the patient, I'm going to start you now on some medication. It's called statin. This medication lowers your cholesterol. This, you have to explain this. You'll have to take it at night. We'll start to mention the dose if this was primary protection or secondary protection, like after a stroke, for example, or something like that. You have to go 80. Primary, you have to go 40. Mention the dose. You have to take this tablet with a glass of water. Explain to them how it's taken, and then at the end, safety net this tablet. You might have some side effect like muscle cramps. If this happens, please make sure you tell your patient, your GP, or be careful when you go to a GP and or any doctor if you're traveling somewhere to mention that you are on this tablet, because there are some antibiotics that should not be taken with this one. You don't have to tell them, oh, clarithromycin because this would cause. No. You just have to say it very clearly. You're talking to a patient, not to a fellow. Another example. Let's say we started the patient on warfarin. This is a little bit tricky. Why? Because we all know that warfarin is an art. The dose is not steady every day. Sometimes, of course, not always. We know that we need to mention to the patient that we need to monitor INR. Here you also have to mention what is the target for their INR. It depends if this is AF, if this is DVT and PE. So you need to memorize the target INR for these cases. Then you need to mention the factor that can affect warfarin. For example, you have to say, well, if your weight changed a lot, it would be suitable to check with your GP for any change in doses. Well, if you're acutely sick, if you have diarrhea, you have to safety net in tablets like warfarin. These are dangerous things. You have to safety net as much as possible. Well, if you stopped smoking, you have to tell your GP as well. Then don't forget to mention about interactions, like, for example, things that might increase warfarin's affection, like cranberry, like alcohol. You have to say these things. Things that might reduce it, like vitamin K, for example. So tell the patient, I know you might think that taking or over-the-counter supplements might be good for you, but some supplements tend to interact with warfarin. And always advise you have to watch out from falls, from cuts, from excessive bleeding, from signs of bleeding everywhere. Don't forget safety netting a patient's side